we're going to do next, I'm going to show you the uncommon. So uncommon, we're going to add some of our anterior medial, anterior lateral, posterior kind of series of these guys. So we go opposite arm, opposite leg. So what we have, we'll go out of sync rotation and load, the anterior lunge, anterior lateral, and the posterior medial lunge and step across to give us again that out of sync rotation and load. I know that we're on a slant for today. It's great, it's challenging. We'll get into that in another episode as to how and why we can use that to our advantage. We can also go anterior lateral to posterior. The side hill is really, really challenging. Losing my balance a little bit. We can also now go with our anterior medial lawnmower with our pivot lunge. And when we call it a pivot, the reference point is that we're basically loading in a direction and then moving to basically the opposite direction, kind of a diagonal or a crisscross. So anterior medial, we'll go posterior lateral lunge. We have again, we're loading opposite arm, opposite leg, that contralateral load, really winding up that right butt and that rotational transverse plane. We're going to do a posterior lateral lunge, really driving that out of sync rotation. So we have out of sync rotation here, type 2 out of sync rotation here. Pelvis is rotating to the right, shoulder girdles, T-spine rotating to the left, therefore giving us relative left rotation. Type 2 out of sync, we're rotating and side bending in the same direction. Also with that anterior medial lunge, so anterior medial to posterior lateral, anterior medial to posterior. I sometimes add, kind of kick things up a little bit. Go with a little lateral lunge. Go with a little lateral lunge here. So we're really winding up those hips in that side to side plane and really driving that type 2 out of sync. Great little activities to get the hips, thoracic spine disassociating. So pivotal and so important for our walking, for our running, for our striking, throwing, propelling activities, everything we do in function. We need to be able to disassociate those guys to get that slingshot, that rubber band, that bouncy ball-like effect going. We're going to go to our posterior lunge series right now. So what we're going to do, we're going to go right leg forward. You can use your left arm as kind of the driver, the loader, for kind of our out of sync rotation. So you're going to lunge backwards, lunge forward. So as you lunge backwards, load up the butt and that rotational plane, driving the out of sync rotation. As you take your anterior lunge, that pivot lunge forward, pulling with the left arm, rotating the right arm to the left as far as you can. We're going to play around with the dimensions and the angles of those guys as we get into our next 2 episodes as well, to really, really tweak, amp these guys on up for us. So we have posterior lunge, but now we can also add, so a progression to that tweak is to go anterior lateral with it. Anterior lateral, so we have more involvement in that frontal plane, a little bit more of a loading where the pelvis is traveling a little bit further of a distance over the axis of that right kind of leg right there. Driving that out of sync rotation with the left arm pulling, the right arm rotating to the left. So now we have pelvis rotating to the right, we have femur rotating right, but we're going to get that relative internal rotation of that back hip. We're going to turn all those little feedback and sensory receptors in that posterior gluteal group, which decelerate the internal rotation, which allow us to explode and to maximize our efficiency and consistency. So to re-highlight, posterior lunge, we're going anterior lateral. Let's also add a little anterior medial lunge with that. Really twist things up. Pretty challenging little activity. And so rotational plane, that transverse plane, really spinning that pelvis to the right. Got that downhill angle. Again, we'll get into that in a little bit more in further episodes. Keep jamming from there. So posterior pivot lunge series. We went posterior. Now we're going to go posterior medial. So with that, we have rotation of the pelvis to the left. If we really want to spin and wind up that butt and that hip, we can go with a reach to straight front of the knee. We can rotate outside the midline, across the midline. So we'll go posterior medial lunge to an anterior pivot lunge, driving that out of sync rotation. Pelvis is rotating right. Again, trunk is rotating to the left. Let's do a couple more of those guys. Good. With that posterior medial lunge series now, we're going to head on into an anterior lateral. So really winding the butt up from that rotational plane and that side to side plane as we finish. And then really getting after the thoracic spine and that scapulothoracic junction and mobility with that out of sync rotation and that top down driver of the upper extremity, the left but also the right, acting upon the thoracic spine, acting upon that left scapulothoracic joint, acting upon that left hip. Upper extremity plays a great role and deal into how well and consistently well we're moving. And here, and you know what, let's add a little lateral lunge to those guys now. So we're here to here. Posterior medial, drive lateral, posterior medial, drive lateral. And again, we could have done that with our posterior series as well. Here to here. Let's drive posterior lateral now. Let's really get after the hips and that trunk and that side to side plane with our initial out of sync rotation kind of loading. So we're here, and then let's just go straight anterior. The lunge, if it was a true pivot lunge, we're going anterior medial with it. Good. What I want you to do now, posterior lateral. We're on posterior lateral to anterior. We're going anterior medial. Let's just go a straight kind of lateral step across, keeping that right foot flat on the ground, keeping them nice and forward. We want to make sure that the hip and that the gluteal region that puts in that lateral pelvic girdle are not yanking that hip on out so that we can get a good load. Let's do a couple more. Great. So guys, what I want you to really think about and explore doing, to kind of add a little variety and spice of things, is using that single arm loadability with the top down drivers and sequencing a position in lower extremity in the right plane of motion to elicit a response that gives us more mobility. The goals for our performance enhancement therapy regimen, our protocol is to mobilize the tissue, mobilize the joints, and then re-educate with movement. In the sequential series number 2 and 3 coming on up, we're going to talk a little bit more about what we can do when we're in these lawnmower positions after we've loaded to kind of explode out of it, but then also what we can do in terms of playing with surfaces, different surface angles and heights, different little wedges to further drive the proprioceptive feedback that we need to allow kind of neuroplasticity. Plasticity, think of kind of plastic, very moldable. Our body is very impressionable. We need to place our body in environments that are very nutriently dense and rich with feedback pertaining to where the body is in relation to itself and space, and giving it the opportunity to kind of practice, to experiment, to make a couple mistakes. We're not perfect. It's very easy to be cynical. I want you to take these activities and I want you to play with the common and the uncommon lawnmower